Just this week, Walmart settled a $3.1 billion lawsuit for their perceived role in opioid abuse. But at least one local Billings pharmacy owner believes businesses like his aren't to blame.
Addiction's been a problem in society for years, and it's going to be a problem for years to come.
You've probably heard it before. Drug addiction is an equal opportunity destroyer, a multifaceted problem with no simple solution.
For them to hold pharmacies or healthcare accountable for this situation, I find it unacceptable.
Kyle Austin is the owner of Farm 406 and is one of many pharmacists closely following the news of a $3 billion legal settlement from Walmart this week. The giant retailer promised the money to support state and local governments grappling with overdose deaths. And the news follows similar proposals from CVS and Walgreens earlier this month of around $5 billion each.
Where the corporations got their hands caught in the cookie jar is because they moved such a large volume. So their volume contributed to the opioid, but they still followed the rules that were put in place by the DEA, the FDA, the boards of pharmacy. And so that buck got passed on, and they're holding the major corporations accountable, probably because they're the ones with a lot of money.
That money will be used to pay for addiction treatment and drug education across the U.S. But Kyle Austin fears the settlement will ultimately have unintended consequences.
Patients are going to be affected. Independent pharmacies like mine are going to be affected. All the corporations are going to be affected. The doctors are going to be affected.
Austin fears more red tape and higher costs, meaning new challenges for pharmacies and new barriers for patients. He believes a true solution depends on government leaders, who he says need to take responsibility for a problem most refuse to address.
That's really what needs to happen. We need to stop this blame game. Oh, the pharmacies are responsible for the opioid pandemic. They're not. We're here to provide that service to the patients in a reasonable manner. We just need to create the rules so those rules can be followed and patients can still get the care they need.
In Billings, Phil Van Pelt, MTN News.